Hi, I'm Megan Zimmer, and this evening I'm going to be talking about what we learned during chapters 2 and 3 in our textbook. So, chapter 2 talked a lot about quality measures and basically the importance of measuring quality so we can therefore improve. One of the things that we learned about in the very beginning of the chapter is the history. The history includes Florence Nightingale, who's very well known, and what she did was she was one of the first body people who really just focused on improving quality. What she found was that the mortality rates during war were so high, and a huge contributing factor to this was the lack of infection control. So what she did is she really found that she needed to monitor the mortality rate and then therefore work on a quality improvement plan. So I just think it's amazing that quality improvement dates back so far. We've been working on quality here in recent years, especially in the United States, but it has been going back for an extremely long period of time. Chapter 2 kind of just talked about the importance of measurement, and I think that chapter 3 really just kind of brought it all together. So chapter 3, talks about the different types of quality measures, structural, which is associated with the healthcare setting, policies, procedures, things like that, and then the process, which evaluates the appropriate actions to see if they were taken, what things that they could have maybe done differently, and then the outcomes, which the outcomes basically provide an indirect measure for the overall quality of an organization. That's found on page 31. And essentially, when we're constructing some sort of measurement, we need to have a baseline. So we have a baseline in which we can measure something, and then we kind of can figure out, the trends, figure out cause, effect, things like that. And, one of the ways that they did this in our textbook, we talked a lot about the use of charts, which I know in my healthcare organization, we do use, different sorts of charting. Every single year, our doctors, for quality and safety measures, we have certain metrics that they need to meet, whether that's a percentage of preventative care measures like breast cancer screenings, colonoscopies, things like that. So we're trying to, prevent people from developing, for instance, breast cancer. So what we do is we try and push, especially during the month of October, breast cancer awareness, for people to have their mammogram screenings done. And so, that way we can measure if we are having improved outcomes, early detection, things like that, based on the data that we have. So we use a lot of charting for that to kind of see trends from a year-to-year basis. Again, really focusing on prevention and things like that, which does improve our patient safety. But the example that was actually used in the textbook was charting hemoglobin A1Cs, which is huge for our diabetic patients, just making sure we monitor that really closely, and using a control chart. Another thing that we learned about in chapter 3 is benchmarking, which is an effort to determine the current status of quality and compare it to the highest performers internal to the organization or external to the organization, and that's found on page 35. I found that super interesting. Benchmarkers are obviously extremely important. Again, we can't have effective measuring without that. And so I thought it was really interesting. We talked about in the textbook the desirable characteristics of measurement and what that is, and just thought I'd read those off really quick because they're really important. Relevance, evidence-based, reliability and reproducibility, validity and feasibility. And essentially what we need to do is then focus on interpreting the quality measures and using evaluation and measurement to do that. Chapter 4 on page 43 had something really interesting, talking about how we can kind of wrap that back up into patient safety. So they said that for patient safety, we need to reduce reliance on memory, and we need to have easier access to it. The EMR is a perfect example of how we can do that. In my healthcare organization, we are so focused on quality and safety, and honestly, there's a lot of human error. We talked about that a little bit later in chapter 3 as well, but if we can kind of eliminate some of that error and having these automated systems, things like that, a perfect example is, human factor is one of the biggest causes of error, and one of the biggest leading causes of death in the United States as far as healthcare is concerned is medication errors. So medication errors include if a prescription's illegible. If there's a transcription error, if there's dispensing errors, administration errors, monitoring errors, and huge way that they've worked to improve this is computerized physician ordering, which is what we use in our system. So if there's a drug interaction, it'll pop up an alert. And so again, I just really found so much value in this chapter on, how we can measure these different areas for improvement, what we can do to then use the measurements and data that we collect to better our patient outcomes. The biggest thing that, I really just feel like every single chapter that we're reading about, when it comes to quality and improvement is continuity of care. I mean, we cannot effectively reach our patients, improve patient outcomes, work on quality, work on safety, without just realizing that everything's all linked together. That's why electronic medical record systems are so great. If one of my patients was prescribed some sort of medication in the ED, I need to know about it when I'm prescribing them something, at their week follow-up here in my clinic. So again, we need to be able to measure all of that so that we can effectively combat it, both with positive reinforcement of using these different systems that we have and using them to their fullest potential. And then I think the biggest thing is, my role as a healthcare professional and a clinic supervisor is to just really make sure that my physicians are on board, get that buy-in from your staff so that everyone can really just understand, there are a lot of huge aspects of quality and safety that I think on a day-to-day basis we overlook. And these two chapters really just kind of honed in on the importance and how we can kind of simplify it and do it every day effectively. So yeah, I learned a lot this week. It was great. Can't wait to learn more. Bye.